In regards to FUE scarring, results are going to vary. Now, it depends on your skin color, your skin type. It actually depends on the type of hair you have, because the stronger your hair, the stronger the supportive tissue. It depends a little bit on the color of your hair versus the color of your skin in regards to actually being able to see those scars. So what you want to think about going into an FUE procedure is, yes, you are going to have scars. Yes, you are going to be able to see those scars if you shave your head down with a Bic razor. In my opinion, and I just had an FUE procedure about 11 months ago, if it's done properly by a right team, the right doctor, and they use the right instrumentation, which all those things kind of go together, it's very difficult to see the scarring from FUE, even at a very low guard. Now, personally, I never thought I'd say this, but I got the real white skin and the white hair, and I mean, you could not see my scarring literally 2 days later, but that may not be the norm for you. If you're an African American patient, if you are a Middle Eastern patient with obviously different skin type and different hair type, you could be someone that's actually whiter than me. Some guys from Ireland or from Europe or whatnot. And depending upon the size punch that the doctor has to use, which is based around the type of hair you have and the type of follicles you have, you may only be able to go down to a half guard, or you may be able to only go down to a 1 guard. So you have to be very careful. Asian patients generally have very, very dark hair on very pale skin. There's an example of how you're going to be able to see those white dots, which is not going to be an advantage for them against me because I have the white skin and the white hair. So what you want to do when you go into these procedures is realize, yes, when there's a hole punched in the back of your scalp, you're going to have a scar. You need to choose the right doctor, choose the right clinic, make sure that they're doing it properly, make sure you're not buying into just a machine and not the doctor and not the clinic. Dr. McGrath turns away about 85% of the patients in a good way. That is only going to be in their best interest because they may not be good candidates for FUE. If he were to do those 85% of those patients, we'd probably have some issues and not so nice comments about the scarring, because you need to see a specialist to determine as best as possible what kind of scarring you're going to have and if it's even a good idea to do a hair transplant at all. Hey, I hope that helps you out. Thanks again for sending in those comments. Make sure that you subscribe to Dr. McGrath Medical YouTube channel.